Ms. Irene Quay.
Mr. Deputy Speaker, sir, I declare my interest as the President Pharmaceutical Society of Singapore. I salute to our government for maintaining strict control over the misuse of controlled drugs in Singapore, especially with the recent and timely amendment to the Misuse of Drug Act to hold accountable any person knowingly or recklessly leaving controlled drugs exposed within a child's reach. We have seen many tragic stories of children ingesting such controlled drugs by accident, which has resulted in overdose cases ending up at hospital emergency departments. At my recent attendance at the World Pharmacy Congress in Glasgow, I've learned from pharmacists practicing in Africa, Canada, UK and United States about the worldwide issues regarding drug abuse. The situation is currently out of control, resulting in countries no longer looking to curb the problem, but instead resorting to setting up needle stations to try, at the very least, prevent abusers from contracting HIV or hepatitis C infection. Such a defensive approach does not attack the root cause of the problem, and the harm caused by the abuse of these substances on the abusers, their family, and the society at large is devastating. First and foremost, even though the situation is much more controlled in Singapore due to our strict laws regarding drug trafficking, I still have my reservations and concern for potential abuse in prescribing of controlled drugs in Singapore. According to the Singapore Medical Council (SMC) annual report from 2012 to 2017, there's an average of 2 to 3 cases of errant prescribers was being censured, fined and suspended every year due to inappropriate prescribing or sales of narcotics, codeine-containing preparation and controlled drugs. Could this just be the tip of the iceberg? I quote Professor Teh Boon Keng, Emeritus Consultant and SMC Council Member, who is also the chairperson of the MOH Opioid Guidance Work Group. These past errant cases are all from the private health sector, and tremendous expense was taken to take action, mostly legal, against these practitioners. In contrast, prescriptions in public hospital and polyclinics are limited by IT system restriction and second layer of screening by pharmacists. This problem is almost non-existent. So are there plans for MOH or MHA to consider dispensing separation for controlled drugs and other drugs of abuse, including hypnotics and codeine-containing preparation, to deconflict prescribing and dispensing of such drugs with potential for abuse? Such a move will allow pharmacists to provide oversight of such prescriptions, evaluate for appropriateness of use and duration of treatment, as well as to contribute to national aggregated information to flag out high-risk prescribers or patients. The dispensing separation will add additional barriers to access for addicts and hence reduce opportunity for abuse, prevent unintended addiction to a significant extent by the general public, and safeguard physicians from such malpractices. Secondly, over the years, there has been an increase in the use of cannabis by drug abusers worldwide. Cannabis is now legalized for recreational use in Uruguay, Canada, and 8 other states in the United States, while decriminalized in Netherlands, Spain, Portugal, Jamaica, Slovenia, and Colombia within recreational limits. So with such ease of access to such substances overseas, how can we heighten public awareness, especially for our children going abroad to study during their formative years, so that they are more prepared for the potential risks? Can we incorporate such awareness program with rehabilitated ex-offenders sharing their experiences into briefing sessions for students before they go abroad? Should we conduct more studies to find out the risk factors and reasons as to why these kids pick up such habits when they are away from home? To add on, cannabis may be the active ingredient in many non-medicinal products presented in myriad formulations such as secrets, vaporizers, herbs, lotions, and oil. Some may mistakenly purchase this item innocuously without knowing that the active ingredient is prohibited in Singapore. How can we ensure that the public is well informed of these risks when they travel overseas and avoid unknowingly bringing in these illegal products when they return home? Can we include a mandatory in-flight education video or booklet for people departing and returning from Singapore. Lastly, with medicinal cannabis now legalized in 44 countries worldwide, each claiming their benefits for certain intractable medical conditions, though yet to be proven, but there are increasing clinical trials, how do we plan on handling patients prescribed with first schedule Class A drugs, for example cannabis, for medicinal purposes if they intend to enter Singapore? Notwithstanding my proposal and concerns above, I stand to support the bill. Thank you.